There are hundreds of videos out there explaining facts and debunking myths on Invisalign treatment. As the largest clear aligner brand on the market, it's easy to understand why it's causing so much fuss. In fact, in Australia right now, there are roughly 8 different clear aligner brands competing for prominence, but not all dentists use them. So today, rather than sprouting a list of facts or myths on Invisalign treatment that could confuse you, I'm going to show you 3 examples of where we've treated patients using Invisalign and let the results speak for themselves. For this first case, this patient came in unhappy with the crowding, and there are also some top front teeth that had rotated, and there had been some damage from acid erosion and chipping of the edges. We discussed a plan of Invisalign treatment to shuffle the teeth into the correct position and derotate them. We then carried out some home tooth whitening followed by composite bonding and a small gum lift. This then helped improve the tooth proportions and balance out the gum heights. For this second case, this patient came in unhappy with her incisal embrasures, which are these gaps where the teeth touch at the biting edge. This patient felt that they were too open and the teeth were too curved, which we could see and we agreed with. We discussed various treatment options, including straightening the teeth, aligning them, composite bonding and porcelain veneers. This patient wanted a minimally invasive and natural smile makeover, so we used Invisalign treatment to correct some bite issues, broaden the smile. We followed this with home tooth whitening and composite bonding to close up these incisal embrasures and create a natural looking result. So this last case is actually my own story. So I'd had 2 years of fixed braces when I was a kid, didn't wear my retainers afterwards, and my teeth started to move around, got some orthodontic relapse, which is where the teeth start to crowd again. I also had quite complex treatment needs as well because my bottom jaw was a bit too big, which meant I had an underbite. That left me with a few different treatment options. One which was surgery recommended by a specialist orthodontist, but that didn't really fit into my own lifestyle. I didn't want to have surgery at 29 years old, so I instead opted for a slight compromise solution. So we used Invisalign treatment just to correct the bite at the front, to allow the top teeth to sit over the bottom teeth. Then carried out some tooth whitening and replaced some old discoloured fillings that were on the teeth just to give me a result that I was actually really happy with. And I get quite a lot of patients actually asking for a smile like my own, which is quite a nice compliment. Also means I can effectively communicate to the patients what these treatments are like, what Invisalign feels like, what the composite bonding and tooth whitening is like as well, because I've had it done myself. So if you're thinking about straightening your teeth with something like the Invisalign system, the best thing to do is to come in for a consult, sit down with us, we'll discuss what you'd like to change about your smile, and we can discover whether Invisalign could be right for yourself.